Hello, everyone. My name is Allison Klotz, and today I'm going to present to you all about Adderall. So what is Adderall? Adderall is a brand name prescription stimulant drug used to treat attention deficit hyperactivity disorder, also known as ADHD, in children, adolescents, and adults, as well as treat narcolepsy. It is available in an immediate and an extended release formulation, and it is a combination of amphetamine and dextroamphetamine, which are two central nervous system stimulants. Why is Adderall prescribed? So Adderall is prescribed to help improve concentration and focus, to produce a heightened alertness, to help those who cannot sit still, to control impulsivity, and to increase wakefulness. Adderall affects the brain in a few different ways. So the lack of dopamine causes people with ADHD to constantly seek stimulation. Therefore, Adderall increases the activity of several neurotransmitters in the brain, including serotonin, norepinephrine, but especially dopamine. Dopamine controls the brain's reward and pleasure centers, creating a feeling of motivation once the patient takes Adderall. Adderall affects the body in many different ways. When a patient needs Adderall and is diagnosed with ADHD, there are mostly positive effects, including that alertness and that control of impulsivity. And it has somewhat of a calming effect to them. Now, unfortunately, for those who are not diagnosed with ADHD and take it recreationally, there are initial positive feelings, such as that feeling of euphoria with that increase of dopamine. However, there is a potential to experience dangerous and physical, emotional side effects as well. There are a few age groups of Adderall users. So the FDA approved that anyone over the age of 3 years old can take the medication. Ages 12 through 17 have the highest rate of ADHD diagnosis, so they are prescribed the most Adderall. However, ages 18 to 25 is the age range that abuses Adderall the most. Many children outgrow ADHD symptoms as their brains change and they learn coping skills and hone their cognitive abilities. 60% of youth with ADHD will continue to exhibit some symptoms into adulthood. However, not everyone is diagnosed and treated with Adderall. Adult symptoms show a little bit differently than children as well, such as lack of focus and trouble staying organized. Adderall is used in a few different forms. So the majority it's basically prescribed in oral tablets and capsules. However, for that young age group, that 3 to 5 age group that maybe isn't the best at swallowing capsules, the parents can crush the pill into a food that they may eat, such as applesauce. Unfortunately, crushing and snorting is also an avenue, which is to achieve a more rapid high that most of the Adderall abusers can take advantage of. Adderall dosing for ADHD varies by patient. It's case-to-case scenario. Ages 3 from 5 years old start at 2.5 milligrams daily, and it can be increased incrementally at weekly intervals until the optimal response is obtained. So children ages 6 and older start with a 5 milligram dose once or twice a day, and it can be increased incrementally at weekly intervals until the optimal response is obtained. So the first dose is usually given upon waking, and then additional doses, maybe 1 to 2 additional doses a day, depending on the person, are intervals from 4 to 6 hours if the drug starts to wear off. Only in very rare cases is it necessary to exceed a total of more than 40 milligrams per day of Adderall. Adderall is also used for narcolepsy, and that dosing varies a little bit as well. So it could be anywhere from 5 milligrams to 60 milligrams per day in divided doses, depending on the individual patient's response. In patients over 12 years old, dosing starts at about 10 milligrams daily, increasing incrementally in intervals until the optimal response is obtained. It is very seldom that a child under 12 years old is given Adderall to treat narcolepsy. So there are many short-term effects of Adderall. A laundry list of effects, and it can be a little bit scary when you're reading through these. So they consist of loss of appetite, insomnia, abdominal pain, rapid mood changes, vomiting, nervousness, nausea, fever, dry mouth, tics, tremors, increased blood pressure, growth suppression, headache, irritability, dizziness, tachycardia, diarrhea, weakness, urinary tract infections, blurred vision, change in sex drive, skin rashes, restlessness, seizures, and serotonin syndrome. Long-term effects are just as scary, if not scarier. Aggression, changes in mood and behavior, dependency and addiction, erectile dysfunction and other sexual problems, hallucinations, heart problems and stroke, irritability, lack of motivation, problems sleeping, and weight loss. The majority of these long and short-term effects are felt by people who actually abuse the drug rather than using it as prescribed. How to safely withdraw from Adderall. So you always want to work with a doctor to taper off slowly. Prolonged use of high doses may require medical treatment and therapy. Suddenly stopping is a terrible idea. You can result in a loss of energy, intense cravings, panic attacks, tremors, body aches, mood swings, inability to focus, depression, mental health issues, and short-term memory loss. So Adderall is a controlled substance and is in the drug category Schedule II. This means that it has a high potential for abuse, addiction, and is likely to lead to psychological or physical dependence that could be severe. Adderall is abused in a few different ways. So it's regularly abused as a study drug to enhance focus and increase wakefulness to high school and college age students, just to keep them up all night long so they can finish that paper or study for that exam. It's also used as a crash diet drug for its appetite suppressing effects. And lastly, it's used recreationally as a party drug for the heightened euphoria, energy, and excitability that it can promote, as well as that wakefulness to keep someone up all night so they can continue to party. Street names for Adderall include Addies, Beans, Bennies, Black Beauties, Blue Pills, Co-Pilots, Dexies, Pet Pills, Red Dexies, Red Pep, Smart Pills, Speed, Study Buddies, Truck Drivers, Uppers, and Zing. As you can see, there are a ton of different ways that you can call Adderall. I found interesting truck drivers, and I looked into that a little bit more, and that is because many truck drivers take Adderall so they can continue to drive throughout the night rather than starting at a rest stop, so it keeps them awake and alert as they're driving. Unfortunately, there are counterfeit Adderall pills out there. So when it cannot be obtained illegally at home, chemists decide they need to counterfeit the drug. It can be completely and extremely dangerous and cut with anything, including fentanyl and meth. It can lead to serious health complications, overdose, and death. One pill can kill. 4 out of every 10 pills laced with other drugs, such as fentanyl, contain a potentially lethal dose, which is terrifying. As you can see in the figure, the top picture is of legitimate Adderall, and the bottom picture is of the counterfeit Adderall, and they look identical. Legal consequences for possession of Adderall vary based off the amount that you are caught with. So illegal possession of prescription drugs fall under the Illinois Controlled Substance Act, specific to Illinois, of course. Penalty for possessing drugs illegally varies on the amount of substance that you're caught with. So possessing can be charged as a Class 4 felony, resulting in 1 to 3 years of prison. Delivering or selling the drug can be charged with a Class X felony and resulting in a minimum of 6 years in prison. Some interesting facts I found surrounding Adderall include that 9.5% of high school students in the United States report non-medical use of Adderall. 42% of high school students admit that it is easy to obtain Adderall. One study at the University of Kentucky found that over 30% of its students had abused Adderall at some point in their lives. Adderall has been cited by the FDA for false and misleading advertising. 60% of non-medical Adderall use for ages 12 and up is specifically happening among 18 to 25-year-old patients. Adderall reduces ADHD symptoms in 80% of pediatric patients. Adderall is the most prescribed stimulant in the United States. Adderall is, and other stimulant-related emergency room visits have tripled in recent years. And lastly, in a study of 1,000 people ranging from 18 to 28 years old, 44% did not know the legal ramifications of taking Adderall illegally. 42% did not know the short and long-term effects of taking Adderall. And 40% did not know the legal ramifications of giving away or selling their prescription Adderall. So as you can see, a lot more education needs to be publicized about Adderall, taught in the schools, and maybe a marketing campaign for public health to continue to raise awareness about Adderall and its effects. Thank you so much for listening to my presentation, and I hope you have a great day.